But for now, I'd love to introduce Belinda Oppenheimer, who's going to talk about helping out the herbivores, aiming for the gold standard care of unusual pets. Belinda has nearly a decade of shelter experience with roles ranging from animal attendant to veterinary manager and committee of management member, and nearly everything in between. With a strong passion for unusual pet welfare, she found her niche advocating for the little guys in the shelter environment. She currently works as a first opinion and referral exotics veterinarian at Warrenwood Veterinary Centre with Brendan, and loves the opportunity to work with exotic rescues on a daily basis, as well as the odd dog or cat. Outside of work, Belinda enjoys advocating for greyhounds, wildlife, and laboratory animal welfare. So please take it away for Belinda.
I'm sure exactly what everybody wants at 5 p.m. after a very long day of lectures is the weirdo talking to you about rabbits and guinea pigs. Just out of my own curiosity, how many, the irony of asking this question in Queensland, but how many rescues and shelters here would be dealing with rabbits and guinea pigs in some way? Okay, excellent. I was hoping this talk wasn't going to be in vain. And how many of you feel like you could do more with them? Pretty decent number. Excellent. So I'm an exotics vet for now, but I'm very much a shelter vet at heart. So I do feel quite lucky that in my current role, I am working with rescues pretty much on a daily basis, and it's really for them that I'm here today. I feel like there is a fair bit more that can be done at the shelter level to take a bit of that burden off those rescues and using them where we need to. I'm already very acutely aware I'm not going to get through everything I'd like to today, so I'm predominantly here just to bring this topic out and show you some pretty pictures along the way. But me working technology is always fun. Here we go. Hooray. All right, so I really see dealing with these kids as an opportunity for us. As we've seen, we're making these huge strides in dog and cat welfare in our shelters, but I do feel like these guys do still get left behind. We are dealing with exciting times, and that's both in the shelter and dealing in commercial practice, where things have very much changed, even in the past 5 to 10 years. Where these pets were historically, the exciting thing for Easter, out the hutch in the backyard, and pretty much things were done and dusted within the course of a year. We are seeing that real shift where they're becoming the members of the family. We're seeing much more indoor pet keeping, and we're seeing them in our vet practices, which was not a particularly common thing even 10 years ago. So very exciting times, but we need to keep up as well. I would love for our shelters to be able to be seen as the gold standard of where people would come for that information, for the care of those rabbits and guinea pigs. And yes, I would love to talk about all the exotics today, but I'm going to limit it to the rabbits and pigs because we're not even going to have time for that. So, I'm very bad at technology, apologies. So, whenever I'm dealing with rabbits and guinea pigs, be that in the shelter or be that in a client situation, there's one thing I always stress, and that's nature got it right, we're still catching up with our practices. When we think of our rabbits and guinea pigs, they're far less removed from their wild versions than our dogs and cats are, so they retain more of those primitive behaviours. That also being said, they are a prey species. So we deal with that to some extent with our cats being both predators and prey. We try and keep them away from our dogs. We try and make things as fear-free as possible. These guys should be treated no differently, if anything more so, because they are absolute bottom-rung predators. So I know it can be difficult with all of our resources in the shelter. Sometimes the rabbits and guinea pigs might wind up in that cat room. We should be trying to avoid that wherever we can. So the other thing, safety in numbers, I'll touch more on that later, but we are dealing with communal species here too, so whenever possible we should be in sight, sound, smell of others of the same species. So I've popped a couple of pictures there, the first one just because it's really, really cute. There were some baby bunnies I had in at the shelter all lying all over each other. The second picture I've put there, that was Kingsley. Kingsley was castrated by another vet and I was treating him for an abscess he developed. I've just popped that photo there. Thankfully, Kingsley was a very chilled out little dude, but that sort of holding restraint technique would be absolutely terrifying for him. So he's on his back, he's having a sore bit manipulated, he would be a scared little man. So even things as simple as that for checking wounds, we need to be keeping the welfare in mind. So, I know we always want to get those pets in and out as quickly as we can in shelter, and I very much want that too, but I do really stress we need a strict quarantine and observation period with these guys. Being a prey species, we are made to mask any sort of issues. So it's not uncommon for me to assess an animal on its day 1 admission check, go, okay, everything looks okay. By the time the day 8 admission check comes around, after our 8-day stray hold in Victoria, I'm noticing that little bit of pain when I'm feeling that abdomen, or I'm noticing that there's something going on with something in that gut. So I've popped some pictures there. That's from actually research animal research. You can see the rabbit in the top there, it looks bright. Happy eyes, ears up. It actually looks a bit scared, to be honest, but a bright rabbit. If we compare that to the one underneath, it's that grimace in the face. It's those ears pinned back. It can be very, very subtle, and it can be very intermittent, but it's something we need to get used to looking for when we're dealing with these guys in shelters, because often that's all the information you get to lead you to finding more. It is of particular concern because we're dealing with some really, really nasty diseases, particularly with our rabbits right now. If anyone's had any experience with calicivirus in rabbits, I hope no one raises their hand because it is no fun at all. I think of it as super parvo in that it can fly, and I've dealt with it both in shelter and rescue, and it's a devastating disease. So all the more reason for strict quarantine and observations. And use your opportunities. On that note, so this was Cubone. I took this photo opportunistically walking from one part of the shelter to the other, so apologies for the dirty windows. But this is the sort of thing everyone should be trained to be looking out for. If you look at Cubone, who's our little fawn boy in the middle there, he looks sad, particularly compared to his friends. So if you look at the white rabbit down the bottom, we look bright, we look happy. Cubone, he's got that grimace going on. His ears aren't up. He's not a happy boy. I do forget specifically what was going on with Cubone. I think he had pneumonia, but a case from private practice, I have included some gory photos just to wake everyone up at this point in time. But private practice case, the only thing that had changed with this rabbit was it wasn't eating its banana anymore. Its favourite food was banana, wasn't eating its banana anymore. Owners thought that they were, being over dramatic. And the big reveal, maybe, that poor little bunny had disseminated lymphoma. So yeah, word of warning. And I don't want to be 100% doom and gloom, but I want to be a realist about this. We're dealing with species with very fast metabolisms who are exquisitely sensitive to what we provide for them in their environments. So a lot of the times we are taking on board animals that will have ongoing health problems. So dental disease is always the thing I jump to. If we're talking about a dog or cat with dental disease that comes into our shelter, we can treat it. We can extract those teeth. We can send that animal off knowing it can have a good quality of life. If I'm dealing with a rabbit or guinea pig that's got dental disease, I can fix that on the spot, but those teeth are growing constantly. Once there's change in that bone, I might need to be doing surgery up to every 3 to 4 weeks in our guinea pigs in particular. So it is something that we need to face those realities and we need to be prepared for them. So I'm a big fan of protocols. Those of you that have worked with me will be very, very aware of that. But I do think it comes in great handiness when we are dealing with things like dental disease in our animals, that we know have some guidelines as to which way we're going to take those cases. I am a big fan of having all members of staff involved in those protocols as well, so all the way from management down to the animal attendants. I've been very, very privileged to have an amazing animal attendant team who are very, very astute, and I liked them to be involved in all of these decisions too. And if we are electing to adopt out these animals, same as we should be doing with our dogs and cats, I'm a big fan of making sure our adopters are aware of what they're getting into and what the ongoing requirements for that animal will be. So I've just included some pictures now to give you an idea. I'm sorry, it's a little bit of a vet-ish talk, obviously with that being my vet background, but things that we do see commonly. The top picture there were a couple of guinea pigs I saw in welfare practice. They'd come to me for mange, well for seizures actually, but they were seizing because they had such a severe mange infestation. Owner hadn't actually noticed those poor little feet, which have severe, severe bony infection going on there, and that was from being housed on plywood. So that's, again, the sort of thing we see where that's not the sort of change we can fix. I've got the mucky bottom bunny there, very common thing we see. We're dealing with species that should spend 30% of their lives grooming. So if I'm seeing any sort of dirtiness anywhere in the body, I'm looking for what could be potentially causing that. Be that pain in the mouth, dental disease, can't groom down there, arthritis, I'm too sore to reach down there to groom, I'm too fat to groom down there, and very commonly inappropriate diet. But always look for more when you're seeing signs like that. Some more pretty pictures, maybe. There they go. So I know I keep coming back to dental disease. Top left there was a bunny that was actually handed over to our shelter from another shelter. All you had to do was lift the lip and see the rather obvious dental disease we have there. So you can see those two rows of teeth, they're never going to align and wear against each other properly. So ideal world, those teeth would be extracted. Second, I'm back to the dental disease again, second picture along there, another bunny who'd been referred to me by a vet who'd trimmed those incisors but hadn't looked at those cheek teeth. I don't know if it comes out clearly, but you can probably see on the right side of his mouth there's quite a big spur jutting into his tongue, and you can see the ulceration along that tongue. So that's the sort of thing we see really, really commonly. I should note that I have been seeing lately there's a fair discrepancy depending on the demographic area I'm in as to how much dental disease I do see. So you might be lucky and have a lot of rabbits that aren't going to do these horrible things to you, but I really wish that they'd do that for me. Next one along there, I have included quite a few x-rays here because I do find you have to use those supplementary diagnostics a bit more in these guys, again, because of how they do mask things. That was a little guinea pig the animal attendants brought up to me because they thought they might have stood on her. She was showing neurological signs, severe middle ear infection, so very commonly seen. Lower left there, so we should have lovely clear black lung fields there. We have this motley white greyness. Really, really common again. Sensitive respiratory tracts. If we've been housed incorrectly, we get scarring in those lungs. So that's another thing to watch for. And our bottom right there, I don't know if you can see those little vertebrae are all bridged together. That's our arthritis bunny. And some more dental disease, because why not? So you can see it can range from subtle, as we've picked up on the x-rays there, to rather dramatic. Big abscess on the side of the face. So intake treatments, some real similarities to our dogs and cats, some things that are a bit different. I've gone into much detail in all of this in the notes, as well as some resources for everything we'll discuss today. Get your history, as much history as possible. I know we always want that in our dogs and cats, even more critical with these guys given their capacity to mask things. Intake examination as standard. Desexing status is annoying because not all clinics will tattoo the ears like we generally get in our dogs and cats. So hopefully you have some evidence of that if it has happened. Microchip scanning, it is becoming more popular, particularly in our rabbits, for them to be microchipped, so always checking that. Vaccinating all of our rabbits on intake for calicivirus is currently the only vaccine, unfortunately, we've got available in Australia. No vaccinations for our guinea pigs at this point in time. External parasite treatment I've put there as a maybe, so as standard would be treating all of our dogs and cats for fleas, etc., I would think. In these guys, it comes back to the grooming again. Most of them will have a small number of mites that live within their fur, don't cause an issue. So if I'm seeing an overgrowth, I'm looking for more again. And fecal testing. Please don't just worm your rabbits and guinea pigs outright. So it is thought that quite a few of the worms that live in their gastrointestinal tracts help the digestive process. So if I am worried a rabbit is showing signs consistent with some sort of gastrointestinal parasite, I would run a fecal flotation, really cheap, really easy to do in shelters, and I would treat accordingly based on that. Every bunny needs some bunny. So big fan of all rabbits and guinea pigs having companionship in some way, shape or form. That being said, it is fraught with difficulty sometimes. I know it's really, really easy, particularly when we want to get those animals in and out, to adopt out to single homes. Personally, I think we should be moving towards always trying to have these species in compatible species groups. I don't think there's ever a way we as humans can supplement what they need in terms of that same species companion. So, housing in the shelter, lots of details on the notes with regard to accommodating their behaviour, away from predators wherever we can. And then in the shelter, we've got a few options. Ideal world for me would be we have our bunny come in, we have someone who needs a friend for their bunny, we do the bonding on site, off goes the happy new couple. For some of our longer length of stay bunnies, we would bond them on site so that they're going to have some companionship. Of course, it does make it more difficult to rehome after that if you've got a pair. That being said, I've included Oleg up the top there, who thought all his Christmases had come at once when he got 2 girlfriends at the shelter, and we were able to rehome them all together, so that was fantastic. So yes, very much a word of caution in that watership down is probably the most accurate thing we have out there with regards to how bunnies act when they don't like each other. So it is important to have someone who's skilled with bonding to be able to do that. Again, it comes down to experience, learning what behaviours of those bunnies mean. I was, again, privileged to work with probably the best bonder that I've met. So she made my life very, very easy, and we had a good collaboration going there. But you can get there with practice. And quick note, rabbits and guinea pigs should never be housed together. I know some people have them together as pets and never have an issue, and I hope it stays that way for them. But as well as speaking different languages, as it were, so not getting that same stimulation as they would from a same species friend, there can be bullying, and when it's rabbit versus guinea pig, it can be very nasty. And rabbits can carry particularly Bordetella parasite that can cause fatal disease in guinea pigs, which we would like to avoid. So I've included more goriness, because why not? This was a very fun case of bonding gone wrong that I just saw a couple of months ago in private practice. 8-year-old rabbit in renal failure, which made life even more fun. And that's the jugular vein saying hello there. Good news there is she healed beautifully. All right, big fan of the importance of diets with these guys. I know when we're getting the donations of the muesli mixes and things, it can be very tempting to use them, but again, shifting towards to providing that gold standard, I think we should be aiming for the best. Fibre is our cure-all for these guys. Again, bringing it back to how they're acting in the native environment, they're engineered to eat low carbohydrate, high fibre foods, and basically be eating all the time. If we're compacting everything down into those sugary, high starch supplements, we're going to result in dental disease, we're going to result in gastrointestinal disease, we're going to result in obesity, and we're not providing the gold standard and showing the community that that's what we're providing. So 80% hay and 15% vegetables is, in my opinion, absolutely non-negotiable. I've included some more guidelines in the notes there with regard to the variety we want to feed with our vegetables and how much of each of those things. If we're going to feed any treats, I'm usually only recommend a little bit of fruit or something like carrot, things like that, or a veterinary recommended pellet. So Burgess, Oxbow, Vetifarm are pretty much the only ones I use. And just like our dogs and cats, make them use their brains. So they do tend to love those pellets, despite them basically being compacted hay. Something as simple as a toilet roll, pop some pellets in, hay in either side, make them use their brains. We should be considering their mental health in the shelter just as much as we do with our dogs and cats. Quick touch on vitamin C in that guinea pigs can't produce that internally, much like us, so you may have to consider supplementing. Usually not if you've got your diet right. I will touch on veterinary care as well, because I know it can be a big limiting factor in the shelter. I graduated 5 years ago, and I think in my course of 5 years, 5-year-long course, there were about 2 hours on rabbits. So the vets aren't necessarily prepared to deal with these guys, and I know it can be a huge limiting factor finding those that are confident to deal with these species in our shelters. So if the passion is there, fuel it, would be my recommendation, and use your resources. If you know there's a vet in the area or an exotics practice in the area that has the interest in those species, approach them. See if they're willing to help you out, whether that be come do some training with your vet staff, or whether that be just helping you out with protocols. They're unlikely to say no. So use those resources, and you can make it tempting. Most of us vets in the audience would have seen this lovely lump and gone, that would be really, really fun to try and remove, right? So you offer those opportunities, try and get that passion going. That was Cupcake, who I saw a couple of months ago, had been in a home, and that home had decided with their vet that they were going to let the lump grow and then euthanise when the time came. Instead, she wound up in the rescue after 12 months of that lump growing. It was fantastic to try and remove because it had started to turn to bone, but that's the happy ending with Cupcake and her new friend underneath there. So work with the passion, you can get it there. And desex everything, please. Again, I know that it's a potentially limiting factor with that access to veterinary care, particularly with desexing our guinea pigs, which is historically seen as a scary procedure. It's not that bad. They can do it. Encourage. So, as well as being our ethos, the main reason, of course, we don't want to promote breeding of these species out there. We have a bunch of behavioural and health reasons, most commonly being that uterine tumours in our rabbits. I could have put up my wall of uteruses. You're lucky you escaped that today, because the number of tumorous uteruses I have removed from rabbits is insane. So lots of health reasons, lots of behavioural reasons, but predominantly it's about our ethos. We don't want those animals out there breeding. We want to promote desexing. And so yes, lovely testicular tumour there for you in the first photo, and just a couple of spays recovering down the bottom. Ovariectomies, I should say. So top 10 tips, everything in your notes as well, but acknowledge that these guys are very different. They have very different niches, and we should be aiming for the gold standard for them. ensure we do have a strict quarantine period and that we're utilising observation and encouraging everyone to be observing during that period, housing appropriate species groupings away from those predators, diet of 80% hay, 15% greens, 5% extra. Introductions and bonding do require skill, so work on that skill, work on building that, and you'll wind up with much happier bunnies and pigs. And being unable to click the buzzer. There we go, sorry. Chronic health problems are very, very prevalent, so we should be prepared with dealing with them, and we should have all of our staff on board and feeling supported throughout that with a doctor education. Please de-sex everything and vaccinate your bunnies. Facilitate and promote that staff education, as we should be doing constantly, and that's probably why a bunch of you are here, and use all of those resources. Ultimately, passion is key. So feel free to contact me if you do have any questions about expanding or starting a rabbit or guinea pig program, and enjoy the challenge. Thank you.